So we've really built a food environment where we're very focused on these monocrops and we're focused on things like corn, wheat, and soy. And the reason for that is because they're very profitable, right? We are able to export those and make a lot of money off of them. And so we don't really focus on kind of subsidizing and prioritizing a variety of things like fruits and vegetables and legumes and things like that. And so most of our agricultural subsidies go to those commodity crops, corn, wheat, and soy. And actually, we not even all of that is for human feed. A lot of that is for like 40% of corn goes towards fuel and 40% of corn goes towards animal agriculture, which leaves about 20%, for humans. And the vast majority of low nutrient ultra processed foods, that's kind of the basis of those low nutrient ultra processed foods, right? So we're kind of artificially making those foods cheaper and then making produce and the foods that we would recommend as nutrition professionals a bit more expensive. And so that makes them a bit more inaccessible to people. So thinking through those agricultural policies and how can we actually make these foods more accessible for people, looking at local food systems and strengthening local food systems in order, because a lot of people, millions and millions of people in this country live in what we term food deserts, which are areas of the country that don't have ready accessibility to fresh produce, fresh fruits and vegetables. It's very difficult for them to get access to them. Each of those barriers just makes it less likely that somebody's going to adopt those healthy habits, right? And so when we're thinking about public health, it's how can we get this? How can we take care of everybody? So if you think about like the population, you hear a lot about like over 50% of Americans have some sort of chronic health condition, right? And 30% of them are dealing with two or more chronic health conditions. And that's very real. You see a lot of comparisons between the United States and other countries in terms of our life expectancy and our obesity rates. And those are important comparisons, but you can actually do those comparisons right here in the United States. You don't have to look at other countries. You can go by state, you can go by income. If you look at high income versus low income, there's a study out that shows an almost 15-year life expectancy age gap between the highest and lowest income earners for men and a 10-year life expectancy age gap for women. So when you're thinking about public health, you're thinking, how can I improve conditions for the people struggling the most? So if you look at in America, most of the time that's low income and it's also racial demographics, so minority populations. And how can I improve conditions for them? How can we get them adequate food, housing, clean water? And all of those things that kind of healthcare access, all of those things that go into kind of building a healthier population at the population level versus the individual level.